Hello, everybody. On behalf of York Hospital and our Center for Older Adults, I'd like to welcome you to today's Zoom webinar, Building Resilience, How to Eat to Boost Your Brain and Body, essentially reviewing how the foods we eat can help to prevent and diminish cognitive and functional losses as we age. Our presenters this afternoon are registered and licensed dietitian Lacey Bouchard and York Hospital speech pathologist Maura Brown. Lacey will discuss daily nutritional needs for older adults with an emphasis on important nutrients to help protect our brains and bodies and reduce health risks, including the risk of developing dementia. Following Lacey, Maura will review the physical changes associated with normal aging that impact how we experience food and share ways to make mealtime safe, fun, and pleasurable. Before Lacey and Maura get started, we do have a few quick housekeeping notes to review. Our two presenters will speak for approximately 25 minutes each, followed by a question and answer session at the end. Unlike traditional Zoom, where you're able to see everybody's faces throughout the meeting, during today's webinar, you will only see Lacey and Maura, along with their current slides. As participants, your audio has been muted, so if you do have a question, you can type it into the Q&A button located at the bottom of your Zoom screen. Please do not use the chat or raise hand buttons, as those will not be monitored during the presentation. And when Lacey's presentation ends, you'll have a few seconds to type in your questions so you don't forget them before we move on to Maura. If you have a question that for some reason is not answered during our time together today, please feel free to email us at info@yorkhospital.com, and we'll be happy to send a reply following the meeting. Lastly, the webinar is being recorded and will be available to you and everybody in the community next week on the York Hospital YouTube channel. We're very grateful to the Maine Health Access Foundation for supporting this educational webinar and helping us reframe aging and improving care for older adults. So once again, we'd like to thank you very much for tuning in today and spending this time with York Hospital. We hope you find the information helpful, and we're pleased to go ahead and get started as we turn the program over to Lacey and Maura.
Hi, I'm Maura Brown.
Good afternoon, everyone. I'm Lacey Bouchard. I am a private practice registered dietitian right here in York. I'm excited to talk to you today about building resilience and how to eat to boost your brain and body. I just want to let everyone know that I was going to school for a completely different career path, and it wasn't until going to a registered dietitian visit with my father for his newly type 2 diagnosis that I came up with this passion for eating real food and the knowledge that this lady had to tell my father how to eat to not only medicate and prevent his diabetes from getting worse, if anything, improving diabetes. And the knowledge she had is something that I wanted to be able to have for me and hopefully a family someday. So the passion that I have for eating real food to really nourish your body and prevent or diminish disease is great. So I've been a dietitian for the past 17 years in various sessions, such as the hospital and outpatient counseling. And now I'm living my dream of doing nutrition counseling in my private practice right here in the York community. So I'd like to get started with some of our special nutrient needs. So there's all types of nutrients that we need throughout each day. So there's some that I wanted to put some emphasis on. And actually, a third of Americans are actually deficient in both iron, vitamin D, and calcium. So there's a third of Americans that are walking around today deficient in these, and they don't even know it. So I do have some emphasis on those as well. But some of the things I wanted to put up here, again, not to make you feel like you have to keep count of these day in and day out and really keep your numbers of how many milligrams of this and that. It's just a general reference to give you an idea. I am going to go throughout this presentation today to give you tips and tricks to meet these nutrient needs that you have without having to add stuff up, and hopefully it just becomes natural. So as you can see, we have here calories. There's a big difference from 1,600 to 2,000 for women, 2,000 to 2,600 for men. Everyone is different, and everything that we do throughout here in eating habits and stuff and our needs are different. This is a wide range. If you're very limited mobility, not getting up and being able to move around too much, you're going to be on the low end of calorie sides. If you're quite active, exercising 5-6 days a week, or if you're losing weight, you're going to be at the higher end of these calorie needs. We also have here calcium, vitamin D, fiber. And as you see, the fiber here is 22 and 28 grams. Just a fun fact to share with you, the average American gets about 14 grams of fiber a day. So it just goes to show how some of our habits really lack appropriate nutrients. And then protein. This looks a little scary on the slide. It's quite the equation. I am going to make sense of this in our next slide. But I do recommend 1 to 1.3 grams per kilogram, which could be 2.2 pounds of your body weight. And again, I'm going to make sense of that in our next slide. And then the lovely sodium intake is 2,300 milligrams per day. This can vary if you have any sort of heart disease or cardiac issues, hypertension, which is high blood pressure. This may be lower. So again, this is a recommendation, but everyone's needs can be different. So moving on to that protein example equation. So as I said, it's 1 to 1.3 grams of protein per kilogram of weight. No, I don't expect you to write everything down, but maybe a couple of days out of the week, you're sitting to see if you're going to meet these needs, just to make sure it's in your daily habits. So for example, how I got these numbers. If you weigh 150 pounds, your daily protein needs are 68 to 89 grams of protein a day. How to figure that out is I took the 150 pounds that you would weigh, or your weight, you divide that by 2.2 in order to turn that into your pounds rather, and then multiply that by 1 to get the low end of your needs, which is 68. You then do the same equation, multiply that by 1.3, which gives you the 88.6 or 89 if you're rounding, to give you the higher end of your daily needs. So this is a great example to keep handy to figure that out for yourself. Next, we're going to talk about protein in general. So it's important to make sure we get our protein to keep our strength up. So as we age, we naturally lose our muscle mass. So keeping a daily intake of protein high is going to help prevent that. If you become deficient in protein, you can have balance loss, strength loss, and it is actually well known that 30% of men and 50% of women actually fall short of their daily protein needs in America. There are protein powders out there, which I will discuss in our next upcoming slide. However, it's going to be a rule of thumb and something that I continually comment about. I would love to see you meet all of these nutrients by eating real food sources. Those are the best absorbed, the best sources of these things you can get. However, there are supplements and things out there to help us in that they're called a supplement to supplement our daily needs. Just to give you also a rough idea of protein, because a steak and a chicken breast don't come with a nutrition label, about 1 ounce of protein does equal 7 grams. So if you're thinking the palm of your hand, which you've heard before, or a deck of cards, is right around 3 ounces, which would give you 21 grams of protein. So sometimes we feel like it's a hefty number to get to, but if we really try, it's pretty easy to reach our needs. And just to review some protein sources with you, we have seafood, red meat, chicken, turkey, pork, milk, cheese, yogurt, beans, nuts, nut butters, lentils, and eggs are all great sources of a protein intake. So moving on to our protein powders. So these are some common ones that are available: Walmart, Hannaford, Target. Not every one is going to be available at each store mentioned. There is one on here called Unwanted. It is my favorite one I promote. However, that one is only available on a website. These are whey protein powders. They're better utilized by your muscle mass than other protein sources of supplements, not your food. And just to mention the one on here in the green lid, the Orgain, that is for anyone who's vegetarian, vegan, or cannot tolerate dairy products. It is made from a pea protein powder. So there are sources out there like that if you need to avoid certain ingredients. So great things to add these powders to increase protein throughout your day. They can be added to pancake, waffle, or muffin mix, oatmeal, cream of wheat, soups, mashed potato, coffee or tea, your yogurts, smoothies, a cup of milk, chia puddings, pasta sauce, salad dressings, gravy. Protein balls are bars. I encourage people to Google that. That's a favorite snack at my house. They're made from a nut butter, and you can pick your own almond, cashew, peanut butter, and you can add coconut, dried cranberries, whatever you'd like to make them a nice little snack for you and a boost of protein. And you can even add your protein powder into those, or custard, kind of a famous dessert. So moving on to calcium and vitamin D. As we get older, the need for calcium and vitamin D is stronger, or greater, I should say. When we're younger, we're building those bones, and now it's our job to maintain our bones. If you have a deficiency in this, you can have thin and brittle bones. You could get very tired, which is fatigue, muscle weakness, or aches throughout your body. I don't expect you, again, to look at that calcium chart I provided and write down your milligrams and everything else of calcium that you're getting. However, a great rule of thumb is to aim for 3 servings of dairy a day. Also alternatives, whether it's a almond milk, a cashew milk, a soy milk. There's great calcium things out there that are dairy-free if need be. If you do take a calcium supplement, it should also include vitamin D. The vitamin D is actually needed for you to absorb that calcium properly. And again, some sources of this just for review: milk, yogurt, cottage cheese, salmon, green vegetables, eggs, fortified cereals, and fortified fruit juice. Now, just to review, my husband was actually looking at my presentation last night and said, "What's a fortified cereal?" It's the cereals that you get off the shelf, your favorite one, a Honey Bunches of Oats, a Bran Flakes, whatever you're picking. But a lot of these cereals are fortified to add both calcium and vitamin D to them, along with the juices to help enhance our nutrients. Moving on to B12. As we get older, we may lose the ability to absorb B12 properly. B12 is needed to keep your blood and nerve cells healthy. A deficiency of B12 can mean fatigue, which again is tiredness, numbness, poor balance, some trouble with memory, or tingling feet. So all things we're hoping to avoid or not worsen if we're having any issues with cognitive impairment. Certain medications you're taking can reduce your absorption, so that's a great thing to review with your doctor. And you should also talk to your doctor if a supplement is needed to tell you how much and how often. So some great food sources I encourage of B12 would be beef, liver, chicken, fish and shellfish, again with the fortified breakfast cereals, dairy products, and eggs are all great sources. And next up we have iron, a big one. So among older adults, anemia can be associated with the increased risk of developing dementia. So we want to make sure we're avoiding any anemia with our iron, which is a deficient iron intake. So the need for iron does change as we age. When we meet around the age of 50 and older, it gets down to about 8 milligrams per day for both men and women. Prior to that menopause, 50 age range, women have a higher iron need, but this does change to 8 milligrams per day after menopause. Deficiency of iron can again bring on extreme fatigue, so tiredness, weakness, a fast heartbeat, dizziness, and headache. Supplement with only 8 milligrams needed for the day is unlikely, but this is great to review with your doctor and your blood work. They'll be able to tell you if it is necessary. So great sources of iron to include would be meat, poultry, eggs, tuna, salmon, shrimp, tofu, brown rice, broccoli, beans, and spinach. And I highly encourage eating these iron food sources with a vitamin C source, because that actually helps boost absorption of your iron. So vitamin C, I'll be a broken record today pushing fruits and vegetables and plant-based. So lots of fruits, lots of veggies with these sources are going to help you have that overall healthy intake, but the vitamin C needed to absorb your iron as well. So moving on to hydration. So now that we've got our daily intake of these things, we need to hydrate. It's really important to have plenty of fluids throughout the day to absorb these nutrients that you're eating, to digest your food properly, and also to get rid of waste. So you're avoiding any sort of constipation or issues with delayed emptying of waste. Medication may make it more important to get plenty of fluids. That's something that hopefully you're reviewing with your primary care provider. And good hydration is also vital for the brain to function. So if you're running without great hydration and you're already having some impairment and you're dehydrated, it could make that impairment worse for you. So what to drink? First and foremost, I recommend water. There's no sugar, there's no added this, added that, to just plain good old water. However, myself, I get sick of water from time to time. I like to put a pitcher of water in my fridge at home at night with lots of ice, and I'll cut up limes and lemons or cucumbers and basil, orange slices, and throw that in there. And through the night, those nutrients and the taste of that citrus fruit go and naturally flavor the water. There's also plenty of flavored waters available at your grocery stores. Just look for 0 sugar, 0 sodium. There's no reason to have any calories or salt in these beverages. There's seltzer waters, the same, lots of different flavors to meet your taste. Low fat milk's a great option, or if you are having unwanted weight loss, moving that up to a 2% or a whole milk will help boost the calories and fat in that milk. And then calcium fortified fruit or vegetable juice is a great way to get some intake. I do have on there, limit this to 4 ounces. With anything, too much of one thing's not good. We want to use moderation, and there can be possibly too much sugar or calories in this juice, depending on if you're diabetic, if you're overweight, things like that. Lots of people take the 4 ounces and they either add seltzer water or plain water to that to make it an 8-ounce serving, but still the tasty flavor of juice. So with that being said, some tips to get all this hydration in. Leave drinks where they're visible. I know if I have mine out on my desk or where I'm apt to make sure I'm drinking it if I'm looking at it or have to look at it. If I don't have it around, it's very easy to forget until I'm too thirsty. If you have any colored drinks, put them in a clear glass so they're very easy to see. If you're taking any medications or pills, it's great to get in the habit of completing a full glass of water with that pill. And taking sips of fluid with your meals can help digest your food and, again, absorb those nutrients I'm preaching for you to get. Also, in your package coming home is going to be this lovely water bottle from York Hospital. It has the measurements on it with these great motivational sayings to keep you drinking throughout the day. So it's a great way to fill up and make sure you're getting that 48 to 64 ounces throughout the day. I also have other folks who put 6 glasses on their countertop. Once they fill one and complete it, they wash it and put it away. So all day you have this visual of how many or how well or not well you're doing with your intake. Moving on, just switching gears a little bit, we're going to move on to some unwanted weight loss because that can be a huge factor for the older adult. Not everyone, but lots of people are having this issue. So changes can become an issue for proper daily intake, which could lead to a dangerous weight loss. So some of those risks can be a functional decline, infection, exacerbation of a cognitive or mood disorder, which means making those mood disorders or cognitive impairment worse than what they currently were or are, and weakness or loss of muscle mass. So we want to be aware to prevent unwanted weight loss. We want to be aware of any changes, any difficulty with silverware. If you're having any sort of tremors that makes it hard to use the silverware or keep a steady hand. We want to recognize any food or taste changes or any effects of medication. Now that takes a minute with anyone. We kind of go about our day not really thinking, and all of a sudden that just doesn't taste the same. So it's taking a step back to see, geez, this chicken really isn't enjoyable anymore. I'm not eating it anymore because I don't like it. So really keeping a great journal of these change and dislikes or likes and what you're really loving or not loving, maybe for yourself or a loved one who's helping prepare or shop for food would be great. There's also wrist weights and weighted silverware available for purchase. And I know your doctor or occupational therapist can talk to you more about that if that is a huge concern, but it can help with the use of any tremors, the use of cutlery if you need to. And then, as always, discuss medications with your doctor. If you haven't been able to eat or you're not feeling well or have nausea since you started a new medication, maybe that's something to discuss that could be changed to help improve that. Also, with preventing unwanted weight loss, the sense of our smell does get affected as we age. If we can't smell things, it can affect our taste. So if we're not enjoying our food and can't taste it, we're likely to kind of give up and not finish it. So foods may need additional seasonings or stronger flavors in them to be enjoyable to you. If you're around the aroma of your meal cooking or baking, that can help increase hunger and kind of improve that connection to that meal, that you're hungry, it smells really great, you're going to enjoy that. And again, medication or disease, such as delayed gastric emptying, which means your stomach's not emptying as quick as it needs to, can affect your daily intake or your intake at meals. So what I highly preach to just about anyone who walks through my office door, but especially anyone who's having any weight loss issues, is to have 6 small meals throughout your day. Again, real food sources to really get the best nutrition you possibly can. You can break that down to 3 meals and 3 snacks if you want to. It doesn't have to be that. It can be kind of grazing throughout your day. However, if you're eating at 6 different times, that's 6 times to change the meal to a different taste or flavor or food to try to get some nutrition in. If you're having these big 3 meals and one meal is just not doing it for you, or you're too full after a few bites, then you only have 2 other big meals to get those nutrients. So eating throughout the day can help with that. I often tell people to have lots of finger foods available for grazing throughout your day on things that are very easy to chew and eat if you are having any issues with that. I have a fun thing here too that also talks about finger foods as well as distraction or loss of attention at meal times. Is I have this little muffin tin thing that I say it's kind of fun to put out for loved ones or yourself, but to fill up this muffin tin with different colors, but the person's favorite snacks. I know if this was on my counter walking by all day, I'm going to grab and munch on different things to help increase calories and grazing throughout the day, just to get in some different nutrients. And with that, I want you to think at how can I add calories to my meals and my snacks? So moving on to our next slide, I want you to think calories. Basically, somebody who's trying to lose weight, you're doing the opposite. And I want to back up here just to mention in your handout that's going to come out as a package is a finger food idea handout. So I have presented the different food groups and great ideas for that muffin tin or finger foods to have available for you. So thinking calories, how can I add things and make this a little bit more caloric for me to help, improve my weight loss, to gain a little weight? So if you think about it, adding some peanut butter to something is 190 calories if you're doing 2 tablespoons. Drizzling some olive oil on your vegetables during cooking or after cooking when you put some seasoning in, there's 119 calories. Having a little cup of nuts thrown into your yogurt or just to snack on is 206 calories, and that's 1/4 a cup. A tablespoon of jelly with a little tablespoon of butter on your toast in the morning could boost you up 150 calories. A little sprinkle of honey or something sweet on foods often helps you want to eat it. I know I have a sweet tooth. If it tastes sweet, I'm more likely to have it. Adding 64 calories for 1 tablespoon. And again, moving your milk up to whole milk could boost you to 149 calories when you're drinking to get your hydration versus 0 calories in water. I do want to talk about mini meals as I preach those 6 meals. I have a few fun ones that I want to be able to show you today. I have prepared some cantaloupe slices wrapped in prosciutto. And then they have a balsamic glaze on top of them for that added sweetness. If you don't like a balsamic glaze, you can certainly do honey to add some sweetness to that. But with this one, you're getting that vitamin C that I recommend, but you're also getting some protein. So you're getting 2 or 3 food groups in at each mini meal is a great rule of thumb to have. This is one of my favorite snacks and my children, my husband too. Some rice cakes with a little bit of nut butter, some sliced bananas. You could also do strawberries, and I've drizzled honey all over that for a nice little intake. These are actually chocolate rice cakes. They have all kinds of different flavors of rice cakes available to you now. There's rice, cinnamon apple, so you can change with your preference, but that's a great snack. And last but not least, a yogurt parfait. So a great way to use this is some vanilla Greek yogurt. I've got mixed in there some bran flakes for some crunch and texture. And then I've added both blueberries and strawberries for color to really kind of make that look delicious and tasty and something that somebody would want to snack on. I've also provided a few examples here of other mini meals. So you could do cottage cheese topped with some fruit and chia seeds, berries with some nuts thrown on your Greek yogurt, chicken or tuna salad on top of some crackers. Again, the melon slices I showed you, popcorn if you're having it to increase flavor, you could drizzle some melted chocolate on that or sprinkle cinnamon, and a whole grain waffle with some peanut butter slices and banana. I also love turkey and cheese avocado roll-ups, and I often get a fig spread to add into that to increase the sweetness a little bit. And then moving on, just a few more suggestions to help those foods tasty and appealing to someone. So using Mrs. Dash, I think I'm a little bit obsessed with Mrs. Dash because what it is a blend of seasonings that are salt-free. It's actually dried herbs and spices. They're all salt-free, so no sodium, no calories with this. But as you can see, this one is an original flavor. They also have a onion and herb flavor. They have lemon pepper and everything but the salt flavors. They also have a Cajun. They have all sorts of flavors. And these are great things to shake on top of your meats or your vegetables with that olive oil to really increase the flavor of something in case you are losing the sense of taste. Often it is salt. So we feel like we're adding the salt shaker, but this is a healthier alternative. And some other suggestions would be to marinate your meats. So putting steak or chicken in a marinade for a half an hour or longer can enhance the flavor. Using any sort of vinegar or citrus on your meats or vegetables. So a little squeeze of lemon or lime can give that little zest to make it more flavorful. Again, adding sweetness to food seems to be a big help as we're losing that salty taste. Sweetness is great. So throwing some brown sugar into your oatmeal, a drizzle of honey here and there can be a great thing to do. And again, I like a fig spread or a jam on top of my meats sometimes to give it just that little hint of flavor. Gravies, sauces, and salad dressings are also great ways to only add calories, flavor, and moisture some of your foods as well. And I think it's important that we offer and prepare foods with lots of colors and textures to really keep people engaged. It's not something bland and boring. And just to wrap up, just to talk about a little bit of the research, clearly research is ongoing every day and we need lots more, but the research that has been done is proving that the Mediterranean and Mind diet, which I'm going to outline for you, can have a protective effect on brain health. So it can help decrease cognitive decline or lower the risk of cognitive impairment. And some of the outlines of this is a high intake of plant food. So I'm going to say it again, lots of fruits and vegetables, making sure you're getting healthy fats with an olive oil, an avocado, but great fat choices, lowering your saturated fats, and an emphasis on fruits and vegetables. They also emphasize dark leafy greens and berries to protect, but limiting saturated fats, red meats, too many sweets and fried foods is a general rule of thumb to really eat so we're promoting appropriate health for our brain. And that wraps it up for me. Thank you very much, and I look forward to questions at the end of the session.
Thank you very much, Lacey. That was terrific. So as a reminder for all of you in our audience, you can type your questions using the Q&A icon at the bottom of your screen. We will answer all questions at the end of the presentation. We've already received a couple from you, and we will take those questions after we hear right now from Maura Brown.
Hi, I'm Maura Brown. I'm a speech pathologist here at York Hospital, and I work with swallowing and swallowing disorders. I have over 20 years experience working with swallowing and swallowing disorders. I'm here in the outpatient speech therapy department, and I work with adults currently. I have a special interest in working with the older adult population, having had close grandparents who lived well into their 90s, with my grandmother already almost getting to 100. So I'd like to share my thoughts with you today about how swallowing and challenges with swallowing can impact that ability to be able to feed our brains and bodies. So I'd like to start just with reviewing the normal swallowing process. So for most of us, we think of swallowing as an automatic thing. You know, we just do it. We prepare our meal. We sit down in front of a Wheel of Fortune. We just eat. We just swallow. It's automatic and it's systematic. And if you can fill in that blank with the song, I'll send you an extra prize. So this systematic part is the voluntary part. So you do it. This is controlled by your cerebral cortex. It's what I think of as the big brain. So it's the part of the brain that you think of when you hear the word brain. So during the voluntary phase of swallowing, you take the food into your mouth, you chew, you move it around with your tongue, you prepare it to swallow, and then you move that food back. And when that food hits sensory receptors in the back of your throat, then your brainstem takes over. So this is the involuntary part. So at this point, you have no control over this. So what happens during the involuntary phase, the swallow reflex triggers, the food moves through your throat to your esophagus, and then through a series of contractions in the esophagus, the food moves to the stomach. So that's the basic. It's not all automatic. It's voluntary, involuntary process. So in looking at some definitions, what the heck does that mean? So when we're talking about age-related normal changes to the swallow mechanism, we're talking about presbyphagia. Okay, so those are normal things. There are things normally that happen as we age that can happen to the swallow mechanism that create some challenges. So this conversely would be dysphagia. So dysphagia is a swallowing disorder. So versus just normal things that happen, if those things become severe enough, we call it a dysphagia or a swallowing disorder. So looking first at the aging swallow. So again, our presbyphagia, normal things that can happen as we age. Chewing. So chewing can be a little bit slower. It can take a little longer to process things and get things ready to swallow. Dentures, you might have dentures. So many times in the clinic, I hear, I paid a lot of money for these things and they never fit right and they don't feel the same. And I know my grandmother used to say, call them her store teeth. I can't eat that with my store teeth. I can't chew the same way. So the swallow reflex triggers a little bit more slowly. We have alterations or dulling of taste and smell. The swallowing muscles, so tongue and throat, are a little bit weaker, work a little bit slower. The swallow reflex triggers a little more slowly. We don't feel things quite the same way in our mouths and our throats, just with a dulling of the senses. We feel full faster. So this is what Lacey referred to as gastric emptying. So when food gets in the stomach, it takes a little bit longer for the stomach to process and move the food to the small intestine. So we just feel full. So you might hear someone say, I had a sandwich for lunch. I don't really need dinner. I still feel full. Peristalsis is the process of food moving through the esophagus. So that is just another aspect that can be slowed with aging. Your esophagus or your food tube, sometimes there is less opening in the upper part and actually in the lower part as well of the esophagus. So what we have is difficulty food passing into the esophagus, or perhaps food getting backed up in the esophagus without that ability to kind of release the food into the stomach. Respiratory muscles can become a little weaker. So with weakened respiratory muscles, that can increase risk of aspiration. So the lungs normally can process foreign material to try to eliminate it. And if those muscles are weakened, then that that particular function is a little challenged. So with that increased risk of aspiration can also be due to just distractibility. So sometimes as we age, if a little something crops up with our swallowing is a little more challenging, we have to reduce those distractions. So something like watching TV can be enough of a distraction to put you at risk for a little bit of aspiration. So how do I know if I have dysphagia or a swallowing disorder versus just normal age-related changes? So that's what we're here for. So speech pathologist is a professional who can evaluate and diagnose your swallowing and provide treatment if you do have a swallowing disorder. So some of the things that we might ask you in the clinic: do you choke on food or drink? Do things go down the wrong way? Are you coughing during or after swallowing? Do you have trouble chewing, or does food feel stuck in your throat? So those are just a few things that we might ask you in the process of evaluation. So what can I do if I have a swallowing disorder or dysphagia? So usually when you come see us, we work with you to try to manage whatever is going on with your swallowing. So we try to work with your likes and your dislikes as far as food, any medical concerns that you might have, any doctor ordered diets that might kind of impact what we do. And we can provide therapy exercises if it's warranted to try to strengthen your swallow, or give you some suggestions on how to compensate for your swallowing problem. So I'm going to move on to, in thinking about dysphagia or swallowing disorders, aspiration. So the A word, it's almost like a swear word. Our doctors don't like to hear it. They don't like to see it. We don't like to suspect it. It means that it's the inhalation of food or fluid or saliva in this context into your windpipe in your lungs. So you don't want to inhale things into your lungs. Your perception might be that it went down the wrong way. I hear that a lot in the clinic. People will say, I feel like things are going down the wrong pipe. And that is true because with aspiration, you're inhaling things into your windpipe or your lungs where you want the food to be going down your food pipe, and they're very close in proximity. Aspiration can lead to what is known as aspiration pneumonia, which can be a pretty serious lung infection. So in thinking about aspiration, that brings me to talk about oral hygiene. So oral hygiene, what is it good for? It's good for absolutely everything. So your oral hygiene is linked to so many things, including cardiac health and sinus health. So oral hygiene. So we want to make sure that we're performing a good oral hygiene program regularly. So when we talk about oral hygiene, we're thinking about biofilm. So biofilm is the residue that's in your mouth that contains trillions of microorganisms at any given time. So they say, so I read somewhere in my research that your mouth contains more bacteria than a public restroom toilet. So, don't take that to bed with you tonight. That's put that out of your mind, but just in a sense of thinking about oral hygiene, there's a lot of bacteria in there. So if you have a good oral hygiene program, this can reduce your risk of aspiration pneumonia. And I had read somewhere that it's by about 30%, which is good, which is a really good, significant thing. So what I'm going to do, I'm just going to quickly review my oral hygiene protocol and how to take care of your mouth. So interesting, in preparation for this, I looked at the American Dental Association recommendations about brushing your teeth. And you would be surprised that probably a lot of people are not doing this the way that you're actually told to do it. So the first thing you want to do for good oral hygiene is you want to brush your teeth. So the recommendation is a soft bristled brush, and you angle it at a 45-degree angle to the gum line. And you either go gently back and forth, or some people will say that you just do little circles. So we're going to do that on the top surface. We're going to do that on the bottom surface. Now, interesting that I've not heard before, to do the inner surfaces of the teeth, you hold your toothbrush vertically. And so you're kind of scraping the residue there. And then you go down and you do the same thing on the bottom. And you always want to do the biting surfaces of the teeth. So where you choose. So both sides on the bottom, and you want to make sure you get the top as well. So that's just toothbrushing 101. So twice a day, 2 minutes at a time. So the second part of my oral hygiene protocol is tongue scraping. So again, we're looking at that biofilm where all that bacteria sits, and we want to scrape it off. Now you can do this with your toothbrush, and sometimes toothbrushes like this one will have the little ridges on the back, and that's what it's for. So you can kind of get in on the tongue and in the insides of your cheeks to kind of really get at that bacteria. This is a tongue scraper. This is a Grin tongue scraper, and you can buy these in bags of about 32 from places like Target. So what I'm going to do with my tongue scraper, I usually work from back to front, and you're just putting moderate pressure. And you don't want to hurt your tongue, but just put a little pressure. You want to really scrape the ideas to get that stuff off of there. Okay, and we're just going all the way around right to the tip. So after you've brushed your teeth and you've used your tongue scraper, what I like to use is coconut oil. So coconut oil has antimicrobial properties, so many good benefits of coconut oil, but it feels good in your mouth to kind of swish it around. So what I recommend, this is Cocoa Pull. It's a combination of coconut oil and peppermint oil. I put a pea-sized amount in my mouth, and you want to swish and kind of pull through your teeth for at least 5 minutes, working your way up to 20 minutes. You can either rinse with water afterwards, or you can just kind of leave it. It leaves like kind of a nice moist coating in your mouth. When you use coconut oil, you always want to spit it into the garbage because it is oil, so it can clog your pipes. So always spit it into the garbage. Okay, so we're going to talk about food. So from the perspective of swallowing, we want to eat for pleasure and nutrition with dignity, right? So we want good stuff to eat, healthy stuff to eat, but sometimes we need to have texture modifications because of our swallowing issues. So, so your speech therapist sometimes might recommend thickened liquids. Usually when we recommend thickened liquids, it's because we have done an X-ray swallow study, and we see that when you drink liquids, things are going down the wrong way. So that feeling of it went down the wrong way, heading towards the airway. When we thicken your beverages, we're slowing it down as it comes down your throat, kind of get the mechanism ready to help direct the bolus into your food pipe versus your windpipe. So there are commercially available thickeners that you can put in any drinks. We use those here in the hospital. A variety of medical settings use commercially available thickeners that you can get at a pharmacy. But what I want to talk about is some naturally thickened liquids. Now, with all of this food part of the presentation, just keep in mind this is a pretty broad generalization. You always want to have a speech pathology evaluation for swallowing if you feel like you're having an issue. And then we can really hone in and figure out exactly what you need for textures. But these things are naturally just a little bit thicker. Okay, so we have things like eggnog, tomato juice. So this is a low sodium V8. And when you pour this into your glass, you can tell it's slightly thickened. It's what we call kind of a nectar consistency. And this is a commercially available smoothie, Naked Smoothies. Again, when you pour it into your glass, you'll see that it has a slightly thicker texture. With smoothies, it's always best if you can, from a health perspective, to make your own. You know, things like this that are commercially available, you have to be really careful of sugar and salt. But sometimes for some people who don't have access to the materials that they need to make their own smoothies, these are good on the go or once in a while type things. And this is just another example of one. This is a superfood smoothie. It's called Noka. And this is gluten-free and vegan, and you just twist off the top, and it's very portable and pretty healthy. So those are just a few examples of naturally thickened liquids. Some other ones include things like buttermilk, cream soups, and then naturally thickening agents, if you don't want to use a commercially available thickener, would be instant potato granules or flakes, cornstarch. You could add applesauce to a juice, avocado. Now with avocado, every time I say avocado to a patient, they say, what? You want me to put that in my smoothie? And I say, yeah, trust me, put it in there, put it with some things that you like. It does not taste like you're drinking a glass of guacamole. It's fine. Banana is a good thickener, pureed vegetables to thicken bases of soup, yogurt, sour cream, and tofu. And that's another one that raises a few eyebrows, but silken tofu, when you add other things to it, it's not going to taste like you're just drinking a glass of soy. It's fine. It's good. Trust me. Okay, so challenge textures when talking about solids. So yeah, I've heard people say, what about my Friday night movie popcorn? What do you mean I can't have popcorn? So in general, and again, this is a broad generalization, these are the kinds of things that are a little bit harder to chew and swallow when we're talking about aging population and disordered population. So this would be things like nuts, seeds, popcorn, chips, raw fruit, dry fruit, things that are stringy and fibrous like celery, meats and fish that are tough and dry, whole grains that have a lot of things in them. So while whole grains are healthy, first from a swallowing standpoint, we just want to make sure they don't have a lot of seeds or bulk. This is when we consult our dietitians to figure out how to get these things into the diet. Breads that are hard and crusty, things that are particulate. So particulate meaning things that have a lot of little pieces. So this would be like rice or couscous, things that are sticky or gummy. So for some people, this could be something like peanut butter. For some people, it might be better to put your peanut butter in your smoothie than to have it on your crackers. Mixed consistencies. So this is where there's a liquids mixed with solids. So the perfect example would be chicken noodle soup, where you have a thin broth, you have slippery noodles, and then you have chicken that you have to chew up. When there's any issues with chewing and swallowing, that's a lot of different textures and things to kind of manage in the mouth safely. And then crumblies. So I added my crumbly chocolate chip cookies here. I think of one of my patients that really loves his cookies. So, we don't say, don't have your cookie. We just say, let's try a softer version of that cookie, just as a treat. So moving on to food items, so breakfast and lunch and dinner items. So when we talk about naturally modified, we're talking about things that in their natural state are already kind of modified. So they're already easier to chew and easier to swallow generally. So these are things like pasta salads, macaroni and cheese, potato products. So mashed potatoes, potato pancakes, scalloped potatoes, soups, chowders, bisques, chili. And I hear that they have a great seafood chowder here at York Hospital in the cafeteria. I don't know personally because I'm allergic to shellfish, but I heard that it's excellent and that people love it. Eggplant is another thing, so skin off, biscuits and gravy, meatloaf, meatballs, forms of lasagna, casseroles, shepherd's pie, yogurt, soft flaky fishes, toasted breads or soft breads or muffins, egg or tuna salad. And then some other things that are, again, in their natural state are more or less modified would be your hot cereals. So cream of wheat, cream of rice, oatmeal, cold cereals. Sometimes you may have to soak it a little, let it sit a little bit in the milk so it's not so crunchy, so you don't have that mixed consistency. Eggs in various forms are generally easier to chew and swallow. So soft and hard boiled eggs, custards, quiche, omelets, souffles, things of that nature. Vegetables and fruit that are soft, skin off. Cottage cheese or ricotta cheese, tofu. For your green salads, it might be something that you're able to manage just if you dice it up a little bit. Might just take a little bit of a change. mashed veggies of any kind, creamed veggies, and then beef in a diced or ground form, moistened. So with some gravies and sauces. And we always try to think of healthy ways to try to moisten things. Some desserts that are in their natural state, they're easy to chew and swallow, be mousse, creme brulee, puddings, custards, soft cookies. So again, not saying don't eat cookies, but maybe a softer variety of cookies, cheesecake, and things of that nature. So that's some foods. Now I'm going to move back here for a minute. You'll be getting a handout on some naturally modified snacks for your movie night. So what do we do when we can't have the popcorn? And these are just a few suggestions, and some of them are healthier and some of them are just once in a while sort of treats. So what I have here is, these are pea snack crisps. And these are really good. My 10-year-old eats these, loves these. And Pirate's Booty is a favorite too. And this is yummy. And again, it's a little crunch. When you chew it, it melts a little bit in your mouth. It's a little bit easier to swallow. It doesn't leave kernels or anything in your mouth. These are made from chickpeas. These are called hip peas. And again, just a crunchy, fun little snack that's not going to leave a lot of residue and things in your mouth to worry about when you're swallowing. And then we have some soft baked cookies. And this is a brand, Enjoy Life, that is also free of most allergens too. So if there's allergy concerns, and then you get a nice soft, easy to chew cookie. And this is a just for special treat. So we have our Lindt truffles, and these are just really smooth, melt in the mouth. And they also come in like dark chocolate if you wanted the healthier version of these, but just a few of these in moderation is a good treat and easy to swallow in a general sense. Okay, so now we've talked about what to eat, and now we want to talk about how to eat. So we want to talk about making the environment that we eat in the safest. So we want to optimize that. So I always tell people, forget the romance, right? You know, Valentine's Day is coming up, but put that aside. We don't want mood lighting. We want to have optimal environment to see what we're eating and to swallow safely. So my suggestions for people are to sit at the table if you can. I have so many patients. I think everybody I know has a recliner. And a recliner sounds fantastic, but it's not the place to sit and eat your dinner. If you can get to the table, sit at the table, sitting upright. You want to be relaxed and comfortable, so you don't want to eat under situations of stress. Lighting, you want good lighting. I want to see what I'm eating. I want to see who I'm sitting with. I don't want dim, I don't want candlelight. I want to know what I'm eating. You want your setting to be visually appealing. So this might be putting flowers on the table once in a while, or using nice place settings, or just some cute napkins, or whatever it is that makes you feel like you're sitting down to have a nice meal. You want to take small bites and sips. You want to eat slowly and taste your food. So most of our people over 65, a lot of people are retired, and we're just in such a habit of being hurried all the time. Everything is fast. We eat fast. We don't even know what we ate. We don't even taste it. And so just, take that upon yourself to just say, hey, now I can sit down. I can really think about what I'm eating and I can enjoy it. And if you need those flavor enhancers that Mrs. Dash and stuff, there's ways to do that if taste is an issue. You want to chew thoroughly. Again, those store teeth don't always manage things as well as natural teeth. Socializing. So, we live in a world where it's normal to socialize during mealtime. So, somebody will say, let's go out for coffee. Let's go grab a sandwich. When you have to think a little bit more about how you're swallowing, I say, be together, quiet, talk later. Okay. So eat first, talk later. So digestion. So by sitting at the table, sitting upright, you want to stay sitting up for, at least a half an hour to an hour after you eat. You want the normal benefit of gravity to help bring that food down. So we talked a little while ago about how things are a little slow in passage. So you want to sit upright, don't lay down after you eat. You might want to get up and move around a little bit. You don't want to go for your power walk at Long Sands Beach right after you eat, but you want to just kind of be up and just, again, let gravity assist food passage. Straws. So straws are, sort of a restaurant thing, but it surprises me how many people have straws at home, that they just use straws. And there's nothing really wrong with straws. The one thing I would say about straws is if you do have a little difficulty with control and swallowing, when you use a straw, you're literally inhaling to bring liquid up into your mouth. So if you lack the control to take care of that, once it's there, you could easily inhale the liquid right into your lungs. And then just as a part of just your environment and keeping things, optimizing the safety is just the oral hygiene again, is just making sure that you're cleaning out your mouth before, after meals. If you do have a little bit of stuff going down the wrong way, that you're not bringing bacteria down into your lungs with it. So now we're going to have dinner. So this is a recipe that I'm going to share with you. This is zucchini lasagna. So, and I can hear my patients, a couple of you guys, where's the beef? And there's beef in this, so don't worry. And this is something that's perfectly adaptable, whether you're a vegetarian, whether you want your beef. So this recipe, it has zucchini, ground beef, pasta sauce, ricotta, Parmesan, mozzarella cheese, and egg and seasonings. So you could make this vegetarian by leaving out the meat, maybe adding eggplant, bell pepper, any vegetables that are attractive to you. For this, I make it with 75% like lean ground beef, and then 25% of my meat I use an Italian turkey sausage. So I kind of cut down the fat that way. You could make this vegan by substituting the cheeses for vegan cheeses. You can make it completely vegan by taking out the egg as well. So I'm going to show you this zucchini lasagna 3 ways, just as far as texture and modification of texture. So the first plate that you see is just a regular zucchini. I call it regular because I didn't do anything to modify it. So in its natural state, it's a little easier to chew and swallow. And you could see here that there's some chunks in there. I can see the zucchini. We have a nice piece of bread with crust on it, whole grain bread, and we have a salad that we haven't chopped or modified in any way. So it's just our regular plated zucchini lasagna. If I have chewing and swallowing difficulties, I might need to grind it a little bit. So for the ground version, I just used a simple Ninja chopper and just pulsed it a few times. And we got our ground version. So you can see that it's still plated, has a little bit of texture in it. And then I cut the crust off my bread and I added some moisture with a spread or a butter. And I diced my green salad using that Ninja chopper as well too. So here we have our ground version. So some people are not able to chew and swallow the zucchini in its regular state or in its ground state. And sometimes we have to puree things just for swallow safety reasons. And so this is my pureed lasagna. So what I've done with this is I've used an immersion blender, just a handheld blender, and you just kind of press the button and you can add a little moisture in there. So for this, I added a little extra tomato sauce to get the pureed version of the lasagna. And then I've just used some little squeezy bottles, I call them, just to kind of decorate, add moisture on top. And I've used an ice cream scoop just to add some extra ricotta cheese. And here with the pureed version, I have a pureed broccoli with a little lemon yogurt sauce in there. So trying to keep the presentation looking nice for this pureed version because it gets tough. It gets tough for people to want to eat when things are in this modified form. So you can see with my pureed lasagna, as well as my other dishes, I'm trying to create visual appeal. So I make it look nice. I don't just throw it all on the same plate together. From a food service, hospitality industry perspective, I'm using contrasting colors. So I have a white plate and I have my zucchini that's red and then my green broccoli And I've used a brightly colored placemat and napkin. I'm making it look pretty. I'm making somebody who needs to eat like this want to eat this. So in our next slide, with regard to presentation for the patients with dementia, particularly Alzheimer's. So there was a study in 2004 done by Boston University that looked at intake in patients with advanced Alzheimer's dementia. And when they fed people on plates that were red, dinnerware that was red, the intake improved by 25%. So this was a really big study. Researchers since that time that have looked at the similar research have found that other colors work as well too, particularly blue. So that if red doesn't work, try blue. The plates that you see that are red and blue and yellow are produced by a company called Eat Well. And Eat Well produces these vivid colored plates, and they also include accessibility. So curved spoons, handles on mugs, non-skid bottoms. So those are by Eat Well. So what I'm going to do quickly, I'm just going to show you dessert because we had dinner, so now we have to have dessert. So this is a chocolate chia pudding. And I hear you again, why are you putting chia seeds in my pudding? It's good, it adds health benefits. So what I'm going to do, I have here a 1/4 cup of cocoa powder. And I'm going to add to it 1.5 cups of coconut milk. And I have light coconut milk here. So I'm just going to add that in. And it does take kind of a second to incorporate and stir it up. Good. To that, I'm going to add 5 tablespoons of maple syrup. And this is pure maple syrup. You don't want Mrs. Butterworth. You want good, pure maple syrup. I'm going to add some vanilla. This is 1/2 teaspoon of vanilla. I'm going to add a pinch of salt. And then when this is well incorporated, I'm going to add 1/2 cup of chia seeds and get that all stirred up. So with chia seeds, just a couple of quick cautions. They say you can eat them raw. You have to be careful not to eat too much raw. When they mix with liquid, they expand. So what you're going to get when you mix this together and you leave it overnight is you're going to get almost like a chocolate tapioca. So this would be your end result. Your chocolate chia. The seeds maintain a little crunch, but they have a slippery quality, so they kind of slide down easily when you swallow them. You can put a whipped topping on them, or whatever it is that you prefer, dairy or non-dairy. This is a ready whipped topping that's made with almond milk, and it has less than 1 gram of sugar. So there's all kinds of ways to adapt this. And the other word of warning about chia seeds too, just as I end, is that they're very high in fiber. So if you're not used to having a high fiber diet, if you're new to trying to get healthier and add more fiber, just eat this conservatively. Don't eat the whole bowl. It is yummy. You're going to want to, but just be careful about fiber. You get a little bellyache if you eat too much fiber too fast. So that's dessert, and I'm going to end there today. Thank you so much.
Thank you, Maura, and thank you, Lacey, for a great presentation. Before we move into Q&A, and we have received a few questions already, the York Hospital Center for Older Adults wanted to share with all of you a number of resources in Southern Maine for people who need help accessing nutritious meals. We've highlighted some of these resources here on the slide, and we'll be sending a list to all of you who participated on today's webinar as well. So you'll see Meals on Wheels, Simply Delivered, the Caring Kitchen, Table of Plenty, York Community Services Association, Good Shepherd Food Bank, and of course, the York Hospital Home Meal Delivery Service. So with that, we will now answer some of the great questions that came in. I think, Lacey, the first question that we received today was for you, and it is, does the protein powder change the taste of food?
Oh, that's a great question. I'm glad someone wrote that in, because I didn't mention when you were purchasing some of these protein powders, you can get unflavored. Some are strawberry, some vanilla, some chocolate. So you certainly can get, depending where you're going to add these. Obviously, you don't want to add a chocolate protein powder to a butternut squash soup. You'd want to go for an unflavored route that way. If you're using, they tend to have a scoop in them. If you're using one scoop, typically you're not tasting this protein powder at all. If you overdo it with more than one scoop, you certainly can start to maybe change the taste or texture of it and maybe feel a little bit chalkiness of it. But typically, if it's a well-flavored food and you're using the right serving, you're not going to taste this. The other thing is too, if you want to enhance like a smoothie with some chocolate to get the flavor, you would be tasting those ones. Also, if you think about it, and one whole scoop, you feel thickening something too much, even half a scoop for one scoop that gives you 20 grams of protein, you're still adding 10 grams if you only use a half a scoop of something to boost your intake. So that's a great idea as well. Great question though.
Kind of on a similar vein, we received a question before the webinar from somebody who wanted to know, how important is it to buy organic?
Yes, I love that question as well. While some people think, and they're actually right, depending on where you go to shop, it is expensive to buy organic. It's great if you have the ability to grow your own or know someone who has a farm so that you can shop and eat that way. I mean, you would really have to do a lot of processed, added chemicals, this and that, packaged foods, day in and day out, to really get the effects that the research shows promote the organic eating. I always say if you can afford organic, that's great. Choose those products. However, products that are fresh fruits, fresh vegetables, even though not organic, are still the way to go on an intake. So if you have the ability and the means to buy organic, that's great. That's a good route to go. But nothing's bad's going to happen to you if you're unable to purchase those types of foods. It's where you're in the red light if it's a lot of processed and packaged items. But as far as your fruits, your vegetables and meats, it does not have to be organic, but it is a healthy thing to do, again, if you can afford to do so.
Great, thank you. Another question came in, wondering about vegans and the need for higher B12 and iron. Any other vitamins, minerals, and what about unwanted weight loss for vegans?
Yes, so with vegans, you're certainly going to, I would obviously suggest seeing a dietitian, because you aren't going to be able to do all of these food sources given to you today. Vegan is going to be really getting creative with your intake and stuff. Typically, a vegan is going to need probably a B12 supplement. And again, you can talk to your dietitian or doctor and do blood work to see the need for that. But yes, your nutrients are going to adjust. However, just because you're vegan doesn't mean you go out and take every single vitamin out there that you think you're lacking. It's great to talk to a healthcare professional about what you are eating and the current variety you have prior to starting to take extra supplements, not knowing.
Great. Now we have somebody asked, is it okay to always have the same source of protein every day, meaning eggs for breakfast and salmon for dinner every day?
Also, another great question. My passion for food and dietitian, and you've heard before, eat the rainbow. And I did have someone tell me once, is that Skittles? And no, it's not Skittles, it's not sugar. But getting a variety of food, I feel, is very important, because what you may get from beef, you're not getting from chicken. What you might get from spinach, you're not getting from an orange. So if you're limited, again, work with a dietitian to expand that variety as much as possible for yourself. You want it to be, again, something that you will eat. So if it's very limited and that's all you're going to eat, we're going to work with you. But if you have the ability to expand and get varieties in, that's what would be suggested and promoted from a dietitian standpoint.
And I think the last question, and I think we have gone over, so I'm pleased that we'll be able to answer it. Can you comment on the PFAs or chemicals and mercury in fish?
Yeah, so obviously There is mercury levels in different types of fish, and it is depending on which types of fish you're doing. You can certainly find that information on the internet, or I have handouts that I offer to a lot of pregnant women because it's also a safety precaution for them. There are levels of it. So seeking fish every single day is typically not one recommendation that we make. We like to see you have that 2 to 3 days out of the week for a safe level of that intake, pending the fish choices that you're taking. So if that was something you were doing 7 days a week, that's when you should probably talk to, again, a dietitian or your doctor about that intake to make sure it is safe on what types of fish you're incorporating in that intake. But safely, I recommend 2 to 3 days out of the week is safe for fish intake. And also your omega-3s and your healthy fats, that's also a great way to get those in.
Well, again, thank you so much, Lacey and Maura. I think with that question, we've arrived at the close of today's presentation. For those of you out in the audience, we hope you found the information to be enjoyable and educational. Keep an eye out for an email from us next week. It'll have the recording of today's webinar in case you'd like to refer to it in the future or forward it to a friend or a family member who might find it helpful. So in the meantime, on behalf of the York Hospital Center for Older Adults, thank you for attending today's presentation and enjoy the rest of your afternoon.